Hi, everyone. I'm Esther, student from Learning Skills for 21st Century. My topic is to talk about aging population in Malaysia. So, as the birth rate has dropped dramatically, the elderly population has increased rapidly. According to the Department of Statistics of Malaysia, until August 2024, there are 3.9 million senior citizens aged 60 years old and above, and there are 2.6 million citizens aged 65 years old and above. And as for now, the percentage of citizens aged 65 years old and above will rise from 8.1% in 2024 to 14.5% by 2014. By then, Malaysia would officially become an aging population. So what is the problem and challenges we will be facing? The first one will be financial stability. According to Central Bank of Malaysia, before the COVID-19 pandemic, there are only 40% of Malaysians has sufficient savings for their retirement. 75% of Malaysians expressed that they hardly save 1,000 ringgit Malaysia for emergency use. This shows that we have very weak in saving our money. And after the COVID-19 pandemic, according to Khazanah Nasional, over 90% of citizens aged below 30 years old has insufficient savings in EPF. They are unlikely to have 240,000 ringgit Malaysia in their EPF account when they reach 55 years old. The COVID-19 pandemic has worsened the situation. This shows that many people will need to work until they die. Second will be the healthcare system and infrastructure. As the medical science advancement, we live longer and our life expectancy has increased. The elderly are less healthy than the youngs. They can't escape from chronic disease when they grow older. So with the increase of population of elderly, it will burden the healthcare system in Malaysia. And there are insufficient healthcare infrastructure in Malaysia, and Malaysia healthcare system geared towards short-term care and hospitalization. However, elderly with chronic disease require long-term care. Due to insufficient healthcare infrastructure, many facilities already face long waiting lists and the demand will increase in the coming years. The last will be the social impacts. Families often need to take care of the elderly, and in most Asia family mindset, elderly would think that their children should take the responsibility to take care of them. But this will burden their children financial, and they have struggling to care for their elderly aging relatives. This highlights the need of community support and elderly care. We need policies that support the families and promote health aging life, ensure that the elderly remain integrated into the society. So what measurement and policies do we need to tackle these issues? So the first one, a progressive wage policy may help to address the financial issue. And also some experts suggest that to set a regulation on the withdrawal of EPF, restrict members to withdraw their EPF after 55 years old. Members can only withdraw the fund before 55 years old for some special situation. Malaysia government has also increased the cash aid to the needy from 8 billion ringgit Malaysia to 10 billion ringgit Malaysia. They have also increased the tax revenue and implement targeted subsidy. This is to ensure the cash aid is used on people who really need help. The government should also expand the healthcare infrastructure throughout the country, as there are only 393 registered elderly care centres and 26 nursing homes currently. We should also foster a senior-friendly communities through activity centres and healthcare facilities. We should also promote the health and disease and injury prevention, provide health education and counseling, as early intervention treatment can prevent disabilities. We also need policies that promote active aging, ensuring that the elderly remain integrated into society and lead fulfilling lives. We can also consider to increase the retirement age, as work is an important factor to keep the elderly healthy. As more people retire, the workforce shrinks. This can lead to a decrease in productivity. So what should we do? Some suggest we reform the pension scheme to secure the financial stability. Government should invest more healthcare infrastructure and promote lifelong learning and employment opportunities for older adults. Community support is also very important, so we should develop a community support to assist families for caring the elderly. I believe that um, this would lighten the burden of families who take care of their elderly relatives. Have you prepared to have a better and happy retirement life? Let us prepare now. That's all for my presentation. Thank you everyone. Bye.